All right. Hi, everybody. Welcome to our live stream today. My name is Caitlin Seiler. I'm an employment digital content specialist for Ochsner Health, and I'm really excited to say that I'm joined by two of our CNOs from the Bayou region. We're going to discuss nursing opportunities and what it's like to work in the Bayou region today, and I'm very excited to start talking about all of the great opportunities we have. So first, I'd like to start by introducing our two CNOs. So why don't you give yourselves a little bit of an introduction and help our viewers know, understand who you are and what you do for the Bayou region. Jana, would you like to start first?
Sure. I'm Jana Samir. I'm the Chief Nursing Officer for Ochsner St. Anne and for Chabert Medical Center. St. Anne is a facility that is housed in Raceland, and Chabert Medical Center is in the east side of Houma.
And my name is Jennifer Wise. I'm Chief Nursing Officer at Ochsner St. Mary. I have been a nurse for about 30 years. Next year will be 30 years. 20 of those in nursing management. Early on in my career, I did a lot of med surg and surgical units. And I actually started my career here at this facility. It was known by a different name at the time, but actually started here as a nurse tech at the beginning of my career.
Well, thank you so much for telling us about that. It sounds like you've both had a lot of career growth at Ochsner Health, and that's really exciting. And I'm sure we're going to talk about it a little later. But before we get started, I think it's important to help our viewers understand what we mean when we say Bayou region and which facilities we're talking about when we refer to that region. So Jana, why don't you tell us a little bit about your regions, and then we'll learn a little bit more about Jennifer's regions.
Okay, great. So Ochsner St. Anne, like I said, was in Raceland. It's a 25-bed critical access hospital with a 10-bed behavioral health unit. It serves the Raceland, Lockport, Matthew, Thibodaux, St. Charles area. It's a quaint little hospital, and it has been here for quite some time. It previously was a larger facility, and in the recent years became a critical access hospital. At Chabert Medical Center, that's a larger hospital. It's an academic hospital. And we have the benefit of working with some very young, energetic, intelligent residents. The hospital was previously a state-run hospital, and then in 2013 became managed by Ochsner through an affiliation with Terrebonne Health and South Louisiana Medical Associates. So those are the two facilities, one being in Houma and one being in Raceland.
So Ochsner St. Mary is here in Morgan City, Louisiana. We service most of St. Mary Parish, obviously by the name. We are a 142-bed licensed acute care community hospital. And in addition to St. Mary Parish, we also see a lot of patients from the Pierre Part, Louisiana area and on to, say, Amelia and the Bayou Buff area as well.
Perfect. Thank you so much for explaining which facilities we're talking about when we say Bayou region. Additionally, I would also really like to learn more about the services they provide. From what you've told me, some of them are larger facilities, some of them are smaller facilities. They serve a wide range of patient populations. So can you tell me a little bit more about the kind of services that each facility offers? Jana, why don't we start with you in St. Anne and Chabert?
Well, St. Anne, as a critical access hospital, does not have the range that most acute care hospitals have, but we are special because we are a critical access hospital that has an OB/GYN mother-baby program, and I'm really proud of that. And our physicians are a fantastic group who really strive to make sure that our women are taken care of. We do have a surgical suite. It is somewhat limited. We don't do major surgeries here. We choose to forward those to our larger hospitals in our system. But it's a very caring hospital. Being so small makes it really more of an intimate setting for our patients. It is a hospital that prides itself on taking care of its neighbors. In fact, the previous slogan was neighbors taking care of neighbors. And so many of the people who work here have worked here for quite a long time, and they've gotten to know the patients, and in a lot of cases, they are their actual neighbors. At Chabert, previous to their affiliation with Ochsner and Terrebonne Health, it was designed to treat patients who had limited access to health care. So we continue to serve patients who have limited access to health care, as well as patients who have choices to go elsewhere. We do have most services at Chabert. We do not have an OB program, but we have a robust GYN program there. We have many outpatient clinics. I can kind of go by exclusion, and I think that basically we don't do neurosurgery, and we don't do cardiovascular surgery, but we do a tremendous amount of work in the field of orthopedics and general surgery, urology, GYN. So what's special about both the hospitals is they each have a behavioral health unit, and I think that is something that the community greatly needs at this point. Chabert actually has a 24-bed behavioral health unit that remains full, and St. Anne has a 10-bed behavioral health unit that also remains full. So I think those are some special things that are not actually available in other facilities in our area.
So at Ochsner St. Mary, I feel like we're kind of someplace in between the two hospitals that Jana described as far as services. We do have an 18-bed medical surgical unit. We have a full service emergency department. Like I said before, we have operating room services, endoscopy services. We have a 10-bed ICU. We also have women's services. So we do labor and delivery. We have a well baby nursery, postpartum. We also see some pediatric patients on that unit as well. We also have behavioral health services. We have a 17-bed inpatient adult psychiatric unit. And we also have a inpatient rehab. So for post-acute patients, we have a 10-bed unit there.
Well, thank you. I can obviously tell that you are not only very knowledgeable about your areas, but you're very passionate, and you are very proud of your facilities. So Jana, I know that you've been part of the Bayou family for quite some time, and I would love to know a little bit about, how long it's been, but also your journey from where you started to your role now.
Okay. So I have been the CNO in the Bayou region since 2014, but I've been a nurse for 40 years. About 30 of those years were in leadership. I am very passionate about nursing, and I became a nurse because I admired my grandmother, who was a nursing assistant for years in a nursing home. So it's always been my passion to be in nursing. I've been with Ochsner for 12 years now. 5 of those years I was working in the cardiac catheterization lab at Ochsner main campus on Jeff Highway. And then through a series of conversations and some previous peers that I worked with, I decided to no longer commute to New Orleans, so came back to the Bayou region, and through a series of conversations, decided to apply for the Chief Nursing Officer role. And this is where I've been since then. I first started out as the CNO only at Chabert, and then became the CNO at St. Anne as well in 2015.
That's fantastic. What about you, Jennifer? How long have you been not only with the Ochsner team, but with the Bayou team?
So I am coming up on my 5-year anniversary as an employee of Ochsner Health. I actually started in the Bayou at the other 2 facilities. So I was a PRN house supervisor when I first became a team member over there. So I actually worked under Jana and her nursing leadership team, which was great. So when Ochsner decided to take over the hospital in Morgan City, I was approached shortly before that happened. So that was, I guess, summer of 2019. So the first person I talked to about this role was, of course, Jana. So she and I had a really good conversation about nursing leadership and what that felt like with Ochsner and for the Bayou. So I transitioned to the CNO role here in October of 2019 and have been here. So that's almost 2 years now. So a total of 5 years with the Ochsner Health.
That's fantastic. And I know that both of you are in leadership roles now. I think it's very, very cool that you started, under Jana, and now that you work together as CNOs. I think that's a really great example of the kind of career growth and the career family the culture that we have here at Ochsner Health, where we help each other grow. I was wondering, so I know that both of you are still in leadership positions now, but I know that both of you are obviously very still passionate about nursing and patient care. And I want to know, how do you still partner with the nurses and other staff to provide the best care to patients in your regions? Jana, can you tell me a little bit about that first?
Absolutely. I probably more than the team really likes. I'm out on the units talking with them. I remember being a frontline nurse, and it was very special to me when my leader would make rounds and acknowledge and engage in conversation. So I'm a firm believer in building relationships with the frontline leaders and with my leaders. So I very often make rounds. I try to know who the nurses are, something about them. I think that's what makes it special to work in a small facility. You really get to know the team. So I still am very hands-on when it comes to following the patient throughput. I'm very passionate about patient experience and quality, but I'm also very passionate about having a team who feels that they are respected and who feels that the work they do is acknowledged. And we talk a lot about being a servant leader, and a servant leader is someone who works to make the job easier for the frontline staff. So one of the things I say sometimes is, I know you're a great nurse, and I want to make sure that you have the tools that you need and that I remove any barriers that you may have to getting the job done. For example, if every day you come to work and the machine you need to use to do the blood pressure is not working correctly, I want to fix that, because it's already hard enough to be a nurse. But to have to worry about things that don't work or things that aren't convenient, I think it just makes for a more difficult day. So I'm really passionate about staying connected to the front line. And it's a good feeling when you're able to make rounds and you know their name and they know you, and some of them give you a hug. It's not like when I walk in, everybody goes, oh, there she is, run. I try to make sure that people feel comfortable. And in that, they feel like they're able to talk to me, or they're able to bring up issues, and they'll be listened to. So I think that's what makes it really unique about being here in the Bayou, is that we are close enough to maintain that type of relationship and connection.
So I guess like Jana, we also make rounds here at Ochsner St. Mary and stay really connected to our staff members. I feel like with the size of the facility, I do, I know people by name, I know something about them. So, you just really have the opportunity to develop relationships with staff that, long-term staff, that I knew from the time that I was a nurse tech here almost 30 years ago. I still know something about them. They know me. So that's really a benefit of the smaller facilities. I was thinking as Jana was talking, what she was describing is what we call meaningful presence. So really just to be present with our staff, to know something about them, to remove those barriers. When my children were younger, they used to ask me, well, Mama, what do you do? You're a nurse, but what do you do? And even when they were younger, in the leadership role I had, I would tell them that, no, I don't necessarily take care of patients, but I take care of the people who take care of the patients. So I've always, felt like Jana that, I want to be able to remove barriers and just to help them be able to work easier because it is really hard being at the bedside and being a nurse these days. Well, for a long time now, but especially through COVID.
Mm-hmm.
Absolutely. And, speaking of COVID-19 and how challenging that last year has been, I would really like to take a moment to briefly discuss what that experience was like in the Bayou region. Jennifer, especially from your part, because I know St. Mary they had a very unique experience during COVID-19. So can you tell us a little bit about that?
Yes, ma'am. So as mentioned before, Ochsner St. Mary is the newest facility to the Bayou region. So in 2020, in addition to facing the pandemic, we also were going through transition. So what that meant was for us here, the peak of the pandemic as far as influx of patients occurred for us probably around June or July. And so that just so happened to coincide with our onboarding process to transition to be an Ochsner facility. So in addition to completely changing our electronic health record, we also had lots of onboarding events, training events, new orientation, new employee orientation for our staff. So that presented an additional challenge because, folks were stressed by the volume of patients that they were having to care for, just the additional needs that COVID patients required. But, one thing I can say is that even though we weren't fully an Ochsner facility at that time, it never felt like that. We always had the PPE that we needed. Ochsner treated us just like any other Ochsner facility. And it was really nice to see and have the support that, this facility may and probably would not have had prior to becoming an Ochsner facility.
Well, I'm so happy to hear that, Ochsner prioritizes our frontline staff, the safety of our frontline staff. So I'm very happy to hear that. And, I would like to say I'm so grateful for the frontline staff during COVID-19 who were really, the ones taking care of the patients who needed them. So, please pass that on to your staff in St. Mary. Jana, can you tell me a little bit about your experience in the Bayou region during COVID-19?
Sure. Jennifer touched on a few things about being part of the Ochsner system, and I don't know how we would have gotten through COVID without being part of such a fantastic system. There was great transparency, there was communication, there were resources, there was commitment from the top. And I think that was able to be transitioned out to our employees. I was so proud of my team during that time. And, as a person, each nurse was, I'm very scared, about what am I getting into, and what does it mean to take care of a COVID patient, and what does it mean to have a family to take care of when I get home. And I can remember just being so touched by nurses who, one nurse, someone allowed her to use their camper so she could go home and not have to be, exposing her family to the COVID. She stayed in that camper for about 6 weeks. I mean, she saw her children, but she wasn't living in her home. And so many people left their children. So many people, didn't see their parents. And while they were struggling personally, they were still giving. And it was very emotional, but it was also a fantastic time for team building. And I think that as much as the system supported us, we supported each other, and the team supported each other. And we had nurses that perhaps hadn't worked, in an ICU for 5 years and transitioned to another department, but willingly came back in ICU and went from working a Monday through Friday job to working 12-hour nights and extra shifts. And they did it because they cared about their team, and they did it because they cared about the patient. And it was really exciting, and I know, Jennifer, you probably feel the same way, but the innovation that came up. We at the beginning, we were needing to reuse some of our supplies, and one of them was the gown that you used to go into a patient room. And I remember in ICU, they were hanging those gowns up, but it was difficult. They figured out quickly that it was difficult to put it back on without contaminating yourself. Well, the nurse said, well, I'm going to use a coat hanger. And then another nurse said, well, let's get one that pivots. And swivels, so that when we take it off, we swivel it one way, and when we put it back on, we swivel it another. And I just thought that was so cool because that's not something that anybody else had thought about. So, the system was tremendously supportive, and they also were very respectful of the ideas that the nurses presented because they were living in the front line. So it was a difficult time, but it was a very, very touching and inspirational time. And it's never been a better time to be a nurse. I think 2020 was a year of the nurse. And I think the world truly saw that, and the Bayou region really saw it, and our community saw it. So I appreciate you saying that you were acknowledging the hard work of the frontline staff. And what's really cool about it is that they were so humble and said, well, it's my job. We didn't get into nursing thinking that we would one day put our lives on the line, but we did. And it's not just a job, it's a mission, it's a calling. And I think throughout the Bayou region, we saw that it displayed in a way that as a nurse of 40 years, I've never seen. So I'm very proud of my team. And I get a little emotional thinking about it, actually, because they could have done something different, but they didn't. They stayed in there with us. So
Yeah, and I can hear your passion. I can hear about how your gratitude for your team, and just, they probably really inspired you during the pandemic. I can, I can see you. I can see how visually touching you find their passion, and just how amazing the teamwork is in that region. So it makes me very, very proud of not only that I'm part of Ochsner Health, but I'm part of a group of people who are that passionately supportive of patients, who always put patients first, and they figure out solutions to complicated problems. I think that's very, very interesting, and I think it shows that you're not just an employee here. Ochsner Health is going to listen to your feedback. You're on the front lines, and we're going to take your feedback, and we're going to take your ideas and hopefully make patient care better for everybody. So I think you really touched on it. That was a very touching answer, and I'm so proud of the response, both internally and for patients, but also for our employees. I'm very proud of that. So we've talked so much about this region, and we've talked so much about the response that Ochsner Health had for COVID-19. We've talked a lot about your career growth. I want to go back to that. Jana, you had this wonderful phrase that you said used to be our slogan: neighbors helping neighbors. And I think that really shows that they're not just patients to nurses in that region. They're our neighbors. They're our community members. So let's move on to a little happier topic and talk about what do they love about their community? What is fun about living in the Bayou region? I've personally heard, every time I talk to a Bayou nurse, they're always telling me about it's a sportsman's paradise. If you love fishing, if you love outdoor activities, they're always talking how beautiful the region is. So I would love to hear a little bit about you. Like, what do you like about your region and living in your region? Jana, can you tell me a little bit more about the benefits of living in the Bayou region?
well, I'm a little bit biased because I've been here all my life, but like you said, it being a sportsman's paradise, I mean, you can drive 20 minutes and be ready to fish, or you can fish anywhere. But I think more than, the way it looks, and what's available to us is how it feels. So it's a very welcoming community. It's safe. There's very little traffic. In fact, I get a little tickled when I hear people say, man, the traffic in Houma is really bad. And then I talk to my coworkers who live in larger cities, and they're like, this is nothing. So, I mean, you can basically get to work. I get to work in 6 minutes from where I live at Chabert. There's that hometown feel, very friendly people. People look out for one another. The cool thing about Houma and Raceland is that from Houma, it's a 60-minute drive to New Orleans. So if you like the bigger city feel, or you are interested in the arts or the music, or a more robust culture that way, it's only an hour drive. It's 40 minutes from Raceland. And there's a lot of people that capitalize on that connection to a close city, but not necessarily living in that city. So the other thing that I'll warn you about is that there's really good food here. So be ready. It's not the freshman 15, it's coming to the Bayou 15. So I don't want to discourage anybody. We also have some great gyms. But the food is fantastic. And so there's good schools. It's a really good, safe community for children to grow up in. So that's why I love it. And I've been here my entire life.
That sounds like my kind of town. And Jennifer, I heard that Morgan City has a lot of festivals, so they like to have a lot of festivals and a lot of fun there too.
Yeah, we do. We have a lot of similar offerings that Jana spoke about, just being in South Louisiana. But Morgan City hosts the Shrimp and Petroleum Festival Labor Day Labor Day weekend every year, except for last year. So we're really looking forward to it this year. The Shrimp and Petroleum Festival is one of the biggest and oldest festivals in the state of Louisiana. So that's a really big festival for our area. In addition, we have a beautiful riverfront area downtown in Morgan City. So lots of musical offerings down there, art and entertainment at the riverfront. And then actually last weekend, there was a big function for the 4th of July out at the lakefront area. So the lakefront area has camping and a small beach area. Music bandstand is where they hosted most of the events for last weekend. So like Jana said, we're not far from Louisiana. I'm from New Orleans, not far from Lafayette, but you've got really lots of opportunities here locally. But if you are interested in the some of the bigger events that the bigger cities offer, it's not far away either.
No, that's great. And it sounds like not only do these facilities, these are very diverse communities, you have a lot of different kind of communities that you serve. You serve a lot of different areas in your Bayou region. So, I mean, having a very diverse patient population and a diverse community, I'm sure that it's a very good thing for your facilities that Ochsner Health has, solidified their commitment to diversity and inclusion in 2020 by hiring a chief diversity officer, Deborah Grimes, but also hiring new regional diversity and inclusion officers. So I was hoping that the two of you could tell me a little bit more about what that commitment to diversity and inclusion means in specifically the Bayou region. So Jana, would you mind speaking on that a little bit?
Sure. I am so proud of the work that's been done at Ochsner in a very short time. Deborah Grimes has brought a tremendous amount of knowledge and energy to that very important change that we needed to make. And it starts with our Ochsner president, Warner Thomas. I have a personal connection to how important it feels, or how important it is for people to feel valued, and that is that my husband is Black. And I didn't really understand some, talking about the Asian Pacific, the LGBTQ plus, the Pride team. It's just really touching to know that we are working very hard to create an environment where everyone feels safe to be their true self, and being able to be their true self and give them that whole self to the job and to the patients, I think it's vitally important. And Ochsner is, really puts the foot on the gas, and it's been a tremendous effort and a quick growth in that field. So I'm very proud of that.
That's wonderful. And, I'm sure that not only does that help the Ochsner employee experience, but Jennifer, can you tell me how that would impact patient care?
Sure. So in nursing school, we are taught that we treat the whole patient or the whole person and not just the disease. So to me, the D&I efforts really just reinforce the fact that we treat all patients, all coworkers, all team members with dignity and respect. It also reminds us that I think instead of judging people for what they aren't, we recognize and appreciate them, respect them for who they are as individuals, which ultimately results in a better experience for the patients and a better work environment for our employees.
Absolutely. And, I think that it's so great that I work for an organization that prioritizes that, and they understand how important it is to not only be your best self in an employment capacity, but also, how important it is for patient care and the patient experience. So if I was a nurse and I was thinking about growing my career and I wanted to see how I could do that and what kind of opportunities there are to grow my career, I would want to know what kind of things are available at Ochsner Health that I could take advantage of to grow both professionally and personally. So I was hoping to learn more from the both of you about what is there available to nurses to grow their careers, what kind of programs are available, maybe if there's something that you took advantage of yourself to grow your own career. So Jana, can you tell me a little bit more about what's available for nurses?
Sure. There is so much information out there that we offer our staff, but I think one of the greatest things we've done recently is create a transition to practice program. And this is predominantly for the new nurse coming right out of school. It's more of in line of what we do for the med students, where it's an abbreviated internship, and it allows them some hands-on time to refocus on some of the skills they learned in school, some of the theory behind it, and I think it's a year-long program. I may be wrong, Jennifer, with that, but basically it's to help that nurse transition into practice and not feel like the first time they're on their own that they're very scared. So I think it's a tremendous investment that Ochsner has put into that program. As a supervisor, as a leader, I started out as a supervisor when I was at Jeff Highway, and I remember taking my first supervisory training class. And it's funny because yesterday I actually took the book out and I was looking at some of the information, and so I did that. And then when I moved into a further leadership position, I went through an advanced nurse leadership practicum. I was, excuse me, selected to participate in a fellowship program that was fantastic. That got me into a network of CNOs across the United States. And sorry, I guess what I'm saying is, you can grow from a brand new graduate all the way up to a CNO level with the resources that Ochsner offers.
That's fantastic. Jennifer, do you have anything to add?
So like Jana talked about, the transition to practice program, Ochsner St. Mary being the newest facility, so we're coming aboard and kind of learning about all the different opportunities that are available to our staff that they just didn't have before Ochsner took over. So I think the transition to practice is just incredible, like Jana said, for a new nurse who's just fresh out of school. So it just really helps them transition from that academic setting to actually taking a patient load and what that looks like. Just a reinforcement of assessment skills, time management skills, I think are really important for a new graduate. So that program is new to us, but we have a couple of members in it. Ochsner also, tuition reimbursement, opportunities to go from LPN to RN. There's a partnership with Chamberlain University. We've also recently partnered in the Bayou with Fletcher to, really improve the pipeline for nursing, and just really no lack of training resources, both for staff level and for leadership level individuals. There's continuing education available to me and all of the management team with our internal product called the Ochsner Learning Network. Just tremendous growth and continuing education opportunities by being a part of Ochsner Health.
Mhm.
Fantastic. Thank you so much for that. And it sounds like there's a lot of opportunities to grow into, either the leader that you want to be, or at the very least, you can learn more and do, different. I know that there's a lot of different opportunities to experience other units, to experience other departments of nursing. So you really have the opportunity to grow and expand your nursing skills at Ochsner Health. So if I hadn't been part of Ochsner Health, I would be convinced by everything we just talked about that this is the place for me. So if I was a nurse and I was watching this, I would be wondering, how do I join this team? What kind of opportunities are available in the Bayou region for me? So I would really like to talk about what kind of opportunities or openings that you have right now in the Bayou region for nurses, and how they can join the team from there. So Jana, why don't you tell us a little bit about openings on the Ochsner team?
Well, sure. The first thing is, if you're interested, which I think you will be, you can go to our website and to the career section, and you will see all the opportunities that we have across the Ochsner system. Between St. Anne and Chabert, our openings right now are predominantly in our med-surg or telemetry unit. I think there are a couple of positions available in our emergency department. Those are the predominant needs right now, and honestly, I think it's a great place for a new nurse to start. It gives them the opportunity to, like Jennifer said, work on their time management skills, see a great mix of patients, and really interact with a diverse group of patients and physicians. And then as nurses progress through their career, there's opportunities for specialty areas. I do want to say that we do allow nurses to go directly into specialty areas, especially those nurses who have participated in our nurse tech program. I think that that's been a great opportunity for our teams. But you just go online, it's very easy. I think you can chat with someone very easily. Our recruiter can get in touch with you. We've worked very hard in the last few years to make the hiring process a lot more streamlined. So we hope that you do take advantage of those opportunities and become part of a team that is very connected and very professional, and who more than anything cares about the patient.
Thank you so much for that, Mary.
I sure can. We have opportunities primarily on our in our emergency department and our ICU unit. We also have an opening at night on our inpatient rehab unit. And like Jana mentioned, we afford nurses the ability to go into some of those areas that, years ago you would not be hired straight into ICU or the emergency department straight out of school. But, I think we've improved our preceptor programs. We've got competent and trained nurses in those departments to be able to help a new grad be successful in, in areas that previously would have been considered specialized. I'll give you an example. There was a nurse that came to us. She had been with another system within the state. She had been an ER nurse for 10 years, and she had always wanted to be a labor and delivery nurse. And her previous employers just never gave her that opportunity. Well, Ochsner St. Mary, really in collaboration with the Bayou, was able to give her that opportunity to become a labor and delivery nurse. So she's trained here. She is also trained at St. Anne with those nurses to just be able to be proficient and to be safe and effective as a labor and delivery nurse. So I think that's just a testament to just the cohesiveness of the Bayou area as a whole, and just the ability that we have to, safely train on board and precept any and all nurses.
I actually saw that nurse the other day, Jennifer, and she was very excited.
Great.
And she said she has really been having a great experience with the nurses here. So.
Yeah, wonderful.
Well, that's fantastic. And that definitely sounds like we give nurses the opportunity to be the nurse that they want to be. And I think that's great. So if you're a nurse watching right now and you are interested in nursing opportunities in the Bayou region, please go to our website. It's ochsner.org/careers, and you can search through all of our different openings in all of our regions, particularly in the Bayou region. So thank you both for joining. Thanks for everyone else joining me today. Thank you for the two of you, our two CNOs, joining me today. I've learned a lot about what it's like to be a nurse in the Bayou region. And if, like I said, if I wasn't already an Ochsner employee, I would be thinking about joining the team right now. So thanks for everyone joining us. We hope to hear from you soon, and we hope that you consider joining the Bayou region and taking care of patients the best way possible. So thank you, everybody, and have a wonderful day.